Hello, it's Gemma Peters, Chief Executive of Bloodwise. I just wanted to record an update following the changes in guidance yesterday from the Prime Minister about what vulnerable and at-risk people should do in the context of coronavirus. So one thing that didn't change yesterday was the definition of who's in that vulnerable and at-risk group. So that remains anybody who currently has blood cancer, irrelevant of if you started treatment, anybody who has had chemotherapy in the last 3 months, anybody who has had a stem cell transplant in the last 6 months, and anybody who remains on immunosuppressant drugs. You are all in the vulnerable and at-risk group as defined by the NHS and the government. What changed yesterday was the advice about what that group of people should do. And the advice now is that that group should self-isolate. That means remaining at home and limiting your interactions with anybody other than your immediate family. So for example, that would mean not going to the shops to get food, but having food delivered and left on the doorstep and collecting it when the delivery driver or friend who's dropped it round has left. So really quite extreme measures. The other piece of advice that changed yesterday was the introduction of this term called shielding. And shielding refers to the people who live with you and the role that they can play in stopping you contracting the virus. Those people have now been asked to self-isolate for the next 12 weeks with you. There's one big caveat to that isolation, and that is if you are currently undergoing treatment and have appointments at the hospital. Now, some of you have already started to see changes made by your clinical team and how your care and treatment is being delivered. They are the very best placed people to make the right decisions for you. But it is really important that you continue to be in contact with that team and continue your cancer treatment through this period. Because clearly what we're trying to do here is balance risks, and there are risks to you discontinuing your treatment that are likely to be greater than the risks of you contracting coronavirus and not doing well. So it is really important to understand that the self-isolation request does absolutely not apply to your treatment for your cancer. I want to just say a couple of words about children because we've had a lot of questions about that. If there are children and young people in a house where an adult has blood cancer or fits into the vulnerable group as I've just described it, they also are advised to stay at home and self-isolate with you for the next 12 weeks. So that does mean not going to school or college or work and staying at home with all of you. The other group are children and young adults themselves who have blood cancer, and the government advice remains that group, just like the adults, should self-isolate for the next 12 weeks. It is fair to say though, there is some disagreement in the community about whether that is the right thing for children and young people, and let me just tell you why. So there is a little bit of emerging evidence coming from other countries that are further ahead than us that suggests that children and young people with blood cancer do quite a lot better than adults with blood cancer if they were to get the coronavirus. So there is a view that the balance of risks for those people between staying at home and obviously the clear impacts that could have on your mental health versus the risks of being out in the community but socially distancing may be in a slightly different place. However, we've clarified with the government and NHS, and their advice remains that those people, children, young adults who fall into the vulnerable group should self-isolate. But my advice to you is that you talk about this with your clinical team or your children's clinical team because they know your individual case and they know where the balance of risk best sits for you. So that would be my advice in that circumstance. As I've said all of this to all of you, I am acutely aware of what drastic measures they are that you're being asked to take. I know that you will be worried not only about contracting the virus and what impact it might have on you and your health, but also about the impact it might have on your finances and indeed your mental well-being. I want to remind you that you aren't alone, however much it might feel like that. there are many thousands of people in the country who have blood cancer and who are in exactly the same position, and their families too are in the same position. And for you to know that as a charity, I really strongly see our role as supporting you and connecting to those people in the very best way that we can. So I would really advise you, if you're worried about anything, to call our support line, and the number should be in the text box below, or to join our online community. And if anyone needs help doing that, because maybe technology isn't your thing, then we can talk to our IT team. The support line will connect you and they'll be able to help you. So we will be here for you with up-to-date advice, both from the government but also from our clinical and academic colleagues as the situation unfolds and we get more evidence about what's happening. But in the meantime, stay safe and well, and I'm really looking forward to talking to you again soon. Thank you.